Greetings. There is this topic that many doctors shy away from because it's a very sensitive topic and also because it causes a lot of trauma to the woman. But I somebody need to talk about it anyway. And I want to talk about it. It's about stillbirth. Stillbirth. Stillbirth meaning what does stillbirth mean? Stillbirth means that a woman gives birth to a dead baby after 20 weeks. When a woman have give birth to a dead baby after 20 weeks, that's stillbirth. Now, there are two types. There's the fresh stillbirth and the macerated stillbirth. And I don't want to dwell in that. You don't it does not that you should not bother about that. What matters is that they are still both stillbirths. The child is not alive anyway after birth. It's so bad for some women that sometimes they carry a baby up to 38 weeks, 40 weeks, 37 weeks, 36 weeks. And when they give birth to the child is dead. And there are a lot of things that can cause it. But before I go into what causes it, stillbirth is a very traumatic event. It's a tragedy. It's like a woman losing her child. It's worse than having a miscarriage because the child has gone, you have carried the baby for 9 months just to give birth to the child, and the child is dead. And it's a very traumatic episode. Very traumatic. Now, when it happens, the most important thing is console yourself. Eh? Please, that does not mean you should go and tell the person that had a stillbirth that don't worry, you are going to give birth to another child. No, that is insensitive. Tell the person you are sorry. Tell the person sorry. Encourage the person. Let the person see a doctor. Like, let the person exhaust all the medical possibilities out there. You need to find out why it happened. That is that. Now, I want us to go into what causes stillbirth. What causes stillbirth? Now, there are many causes of stillbirth, but I'm going to talk about what causes stillbirth in our locality, in Nigeria and in Africa. Many causes. Now, the first cause of stillbirth is placenta insufficiency. What does a placenta insufficiency? Insufficiency mean? What does placenta insufficiency mean? It's the placenta that supply blood, nutrients, and remove waste from the child, right? Imagine that the placenta is faulty. And as a pregnancy progresses, the function of the placenta, the capacity of the placenta reduces. Now, in a faulty placenta, the child will not thrive well. Enough nutrients does not go to the child, enough oxygen does not go to the child, and the child dies. That's what happens. Another thing is when there is a placenta accident, like placenta abruption. Placenta abruption is when the placenta normally the placenta is attached to the womb, right? There is a sudden separation of the placenta from the womb, and that's catastrophic. It can kill the baby. So it's also a cause of stillbirth. It can happen earlier on. hmm, It can happen earlier on, and it can also happen late, like in 37 or 38 weeks. It can happen late. So that is another cause of stillbirth, placenta abruption. Now, there's an issue with the umbilical cord. Umbilical cord is where blood flows through from the placenta to the baby. Now, imagine that the umbilical cord is twisted. It can happen, twisting of the umbilical cord, squeezing of the umbilical cord. When this happens, when the umbilical cord is twisted, sometimes the umbilical cord can be twisted around the neck. Especially, I've had such episode before. And we ended up doing CS for the woman. Hmm? During while the woman was trying to push, I just realized that I was no longer feeling fitter. The baby's heart. I tried to monitor the baby and noticed that the baby's heart was no longer beat dies. It has dropped from 120 to 60. I knew there was a problem. Then I tried to examine the woman. I realized that the cord, when I looked in, I realized that the umbilical cord has wound around the neck of the child. Then I called for help. I called for help because that is fetal distress. That can kill the baby. So immediately we did a cesarean session for the woman. And truly, when we opened up, we realized that the placenta, the umbilical cord was actually around the neck of the baby, choking the baby and cutting off blood supply. So if intervention have not been taken, if something was not done when that was noticed, the child would have been born stillbirth. That's what would have happened. The child would have been dead, born by the woman, and the child will not cry. The child is dead. So cord accident, umbilical cord winding around the neck of the child can cause stillbirth. Another cause of stillbirth is some children are born with congenital, some babies are born with congenital anomalies. Some babies are born with spinal bifida. Some babies are born with no brain. They call it anencephaly, especially in mothers that didn't take folic acid when they were pregnant. They will have children that have spinal bifida. The spinal cord is exposed, leaking fluid, leaking water from the back. Eh? And sometimes the child is born with almost no head. There's no brain. So those children cannot survive. Eh? They cannot survive. They will be born dead. That's that. That's number 4 now. Then another cause of stillbirth is medical conditions of the woman, like gestational diabetes. The woman is diabetic. The woman is there is hypertension in pregnancy. They are notorious for causing stillbirth. That's why if you have diabetes in pregnancy, you must take care of that sugar. You must control that sugar. If you have diabetes in pregnancy, you must control that sugar. If you have hypertension in pregnancy, called preeclampsia. Preeclampsia is notorious for causing stillbirth. There are some of you are watching now. You know what I mean. Women with hypertension in pregnancy, they are not they are they it's always very common to see them giving birth to children with stillbirth. I'm not meant to scare you. That is why you are watching this video. If you have hypertension in pregnancy, what you need to do is you must make sure that you see a doctor, so that you'll be taking your drugs for taking your medications for hypertension, so that your BP will be controlled, because that BP can kill the baby in the womb. So that is hypertension in pregnancy is a notorious cause of stillbirth. I've talked about congenital anomaly. Women that smoke, women that take alcohol, you can have stillbirth. If you're a woman, you smoke, you take alcohol, you can have stillbirth. So you have to run away from smoking now. Don't smoke at all. Then one other thing is that sometimes the fault comes from you, the woman or the man. You are pregnant, you are in prolonged labor, your labor has been prolonged, that you have been in labor for like 10 hours. Your doctor is telling you that it's like this child, you will need to do CS for this for this labor, because you cannot push your womb. You have obstructed labor, the child cannot come in. You say no, you must deliver. Your man of God told you that you must deliver through the vagina. And some of you get angry, you will discharge yourself from that hospital and be going to another hospital. Before you get there, what do you know what would have happened? Do you know what the doctor have seen before they advise you for CS? You don't know. So please, some of the problem is your fault. By the time you finally get to where you are going to, they will still do CS for you. By that time, and that time the child is in distress. By that time, the child is dead. The child is dead. So that is another cause of stillbirth. So please, listen to your doctors, listen to your midwife. There's no crime, there's no sin in CS. So I've mentioned smoking in pregnancy, taking alcohol in pregnancy, hypertension in pregnancy, diabetes in pregnancy, congenital anomaly, placenta insufficiency, cord accident like umbilical cord winding around the neck of the child, anemia. Anemia can cause stillbirth. When your blood is not enough, the child will not grow well. Enough blood is not going to the child dies. So you can have stillbirth from anemia. That means that is why you must boost your blood when you are pregnant. Boost it very well. Then another one is infection. Sometimes your water broke. Instead of you going to the hospital, you will stay. Infection will now spread through that water to your baby. The baby will now get infected and die off in the womb. So you have to be careful. When your water break, go to the hospital immediately. Another one is what they call oligohydramnios. In oligohydramnios, there is not enough water for the baby to swim through, so the baby may not really be able to survive. The baby dies off. So those are the causes of stillbirth. Bye bye.